welcome to Here's to Your Good Health. I'm obviously not Linda Precioso, but I am filling in for her today. My name is Jean Kitchen, and we are really, really excited about what we're going to share with you today. Dr. Crystal Hayden, who is the Chief Operating Officer and Chief Nursing Officer at Nash UNC Healthcare, is our guest. And Crystal, the hospital is doing a phenomenal job meeting the needs and just getting better every day with reaching out to the community. I hear all around glowing reports. People who've been to the ED said it was fantastic. So we want to learn from you what's going on, how the hospital has prepared for these unusual times, and just kind of let everybody know that you're open, or we're open for business, and they can feel very safe if they or their families need to come here.
Absolutely. Well, thank you, Jean, for having me. It's a pleasure to be with you today. And I do want to just reiterate what you've said. We are open for business. Healthcare is a 24-hour, 7-day-a-week business. And while we had slowed for a little bit of time in March and April and May, we are back up to about 90% of our pre-COVID volumes. We have put a myriad of different elements in place to ensure that we are providing a very safe environment for both our patients and our staff.
Mm-hmm.
So we have had to look at things like our cleaning processes, our cleaning routines, and while hospitals are certainly always focused on that from an infection prevention standpoint, we've had to even do additional methods of cleaning and disinfecting and treatments to ensure that our environment is one that our patients and our staff can feel very comfortable in.
Wait, when people come to the ED, talk us through the process of and again, well, I even had a neighbor who came, and he and his wife have both come multiple times, unfortunately, but they said they felt completely safe, that it was obvious that you all had completely everything under control with rules and procedures that made sure everybody was really taken care of.
Sure. So for our patients who come in through the emergency department, they will notice that we have a clinician sitting at the very front of the emergency department before you ever even enter the waiting room or talk to a registration person. And that clinician is screening for symptoms or exposure. And if there are affirmative answers to those screening questions, or there has been an exposure, then the patient will be directed to a respiratory cohort unit area, and that is separate from the general population for the emergency department. And then once in that area, certainly social distancing is applied, personal protective equipment for the staff and for the patients to the extent that it is appropriate for the patients. And then certainly different types of cleaning and disinfection processes and that type of thing. So at that very first point of entry at the front door of the emergency department, we're trying to identify those patients that we need to move into a different area so that we don't have a mingling of all of the different populations.
Let's back up and talk about when this first happened. There were so many unknowns, and you all have worked extensively with partners in the community too in understanding and planning and getting projections. It's been more than people at home have realized. And of course, we see thank your healthcare providers and whatnot. But we do need to thank y'all, because y'all have been working practically 24 hours a day, bringing in data, trying to address it, just as on the fly, to be sure everybody's safe.
Right. So back when it started, probably the early mid part of March is when it really started hitting home for Nash County, right? I mean, we know in the news it was hitting other parts of the country, it was hitting parts of Europe earlier than that. But for Nash County, it was really starting to hit home in the early part of March. And even as early as that, we have been working with EMS, we've been working with law enforcement, we've been working with the Nash County and Edgecombe County health departments, and really trying to provide a community-wide response and coordination, because not every patient who has symptoms is going to be COVID positive, and not every COVID positive patient is going to need inpatient medical care. A lot of our COVID patients are able to recover at home, and there needs to be resources for them as well, because there will be questions and there will be concerns and different things. And so really working with those community entities to provide a comprehensive support structure for our patients. We've also worked very closely with UNC and with the other entities in the UNC system to make sure that as a healthcare system, we were approaching things in a fairly standardized manner. Certainly an institution like the medical center will have different experiences than a community hospital like Nash, but to the extent that we can provide a unified UNC approach, it provides all of us with a structure and how we deal with things and approach things. So we have been very blessed. UNC provides us a weekly update of projections that we can expect to see specific to Nash. And there is a lot of science behind that, and I won't attempt to describe all of that, but every Wednesday we get an updated report, and based on testing numbers, percent positive numbers, community spread, and those types of things, we have a pretty good indication of what our census points may look like moving into the future. I will say that we use the most liberal estimates so that we are prepared, and what we have been seeing is a little bit more conservative volume. So for instance, the projections right now indicate that our peak will hit around the second or third week of September, and that might look like 50 COVID positive patients in our hospital at any one time, with about 20 of those requiring critical care. That would be kind of the worst case scenario projection, and we likely would see numbers less than that. But we have taken steps to be able to support that number plus an additional number of patients. And so we're always trying to stay ahead of what that projection looks like, knowing that we probably won't get to that very top number, but we're prepared if we do.
And that should provide so much comfort for people in the community. I mean, not only are you taking the top number that UNC says, what might hit, and we're coming in right now under that, but over prepare.
That's right.
And you have the second floor, y'all have done extensive renovations to provide not only for getting us through this pandemic, but potentially future pandemics. Tell us about that.
Sure. So we are doing renovations to our second floor. We have created a space that each individual patient room is negative pressure. And what that has to do with is the airflow in and out of the patient room. And so when you have a disease that is transmitted by an airborne or a droplet type of transmission, you don't want the air inside the patient's room to be circulated out into the hallway. You want the hallway air, which would be your cleaner air, to be circulated into the patient's room, and then that air to be filtered through the hospital's HVAC system and then dispersed. So you want that airflow to be negative and to be coming into the patient room instead of out of the patient room.
And that's pretty I mean, that takes a lot of work.
It does.
To set up each room like that and
It does.
unto itself.
It does. And so that renovation had been ongoing through late May through June and the early part of July. And we have opened that up and have placed patients there. And it really will allow us to care for about 30 COVID positive, medically stable patients at any one time. And it allows our staff to use PPE appropriately, but then also to have periods of time where they can have a break from the PPE because that is really rather taxing when you have to be in it for 8 or 12 hours at a time without a break.
How is the staff? How are y'all doing? I mean, it has to be just really, initially the fear factor, of course, hit all of us, but now that I get the impression when I interact with y'all that you understand it better and everybody realizes that this is doable. You've been able to keep the staff safe. You've been able to protect the patients and take really good care of the patients. So things have hit kind of a more even keel now, haven't they?
They have. I do want to say, first and foremost, our staff is our most valuable resource. And you will hear media talk about PPE being a valuable resource or ventilators being a valuable resource or medications. And while all of that certainly is true, our staff is our most valuable resource because without them, everything else doesn't matter. And they have done a tremendous job in caring for these patients and in caring for each other and being that support structure for one another. And we're just very, very fortunate to have the staff that we do. I think that healthcare, you go into healthcare because you want to help people. And so while there was initially concern because we didn't know a lot about this disease, we have staff members that are volunteering to work in these units and that are volunteering to take the place of fellow staff members that may have a little bit more hesitancy. And so the courage and the bravery of the staff really is to be commended.
So the second floor now, this will be the place where all COVID people go.
All of our COVID positive patients who are medically stable, yes.
What about the ones who are in more critical care?
That's
needs?
right. Those patients that are COVID positive that require critical care will be housed in either of our critical care units. We have a cardiovascular intensive care unit and a critical care unit. All of those rooms have the ability to be negative pressure as well. And so we can care for our critical patients in those areas with the infrastructure that is already there.
And do you have all the supplies? I mean, all the things we've heard around of needing ventilators and needing this and needing that. You all are well supplied, aren't you?
We are very well supplied. Our supply chain team here locally at Nash, working in concert with the supply chain team at UNC, has done a tremendous job in securing PPE. Personal protective equipment. Thank you.
Sure.
It has not been easy and it has not been inexpensive. In the first few weeks of the pandemic, we spent $1 million in securing PPE for our staff and for our patients. And that is about 10 times what we would normally spend in an entire year.
Wow.
But we have built reporting methods, and we look every day at what our days on hand are for each type of PPE. And our supply chain team does a really good job of keeping a threshold number of days. And so we are very comfortable with the supply of personal protective equipment that we have, and we are able to supply it for our staff and really not worry about running out at this point. They've done a really great job securing that for us.
Well, and y'all have all done a really great job, and I think all of what we've heard so far ought to give a lot of just comfort to people in the community that our hospital is ready and doing a stellar job. We're going to take a break and we'll come back and learn more, folks. Stay with us. And we're back. And again, I'm not Linda Precioso. She is fantastic. She let me sub for her today. So I'm Jean Kitchen, delighted to be here. Dr. Crystal Hayden, who is one of the executive team with and I have to say, Dr. Lee Isley has put together a wonderful working team, assigning your chief operating officer and chief nursing officer. But the energy, the commitment, the changes in the hospital, and we're going to address some of them because our community with recruiting more physicians and whatnot is just getting, the hospital is becoming more fantastic all the time, in my opinion. But one thing you brought up during the break that I want to be sure, when people come, they're screening to visit somebody, and some people can have visitors, but is it one per patient, or kind of tell us how that works so they won't be caught off guard?
Sure. So I think this is very important for the community to know that any screening questions or masking requirements or visitor restrictions that we've put into place really is out of the utmost concern for their safety. It is not to be a barrier by any means, but it is really about keeping the visitors, the staff, and the patients all safe to the extent that we're able to do that. So anytime a patient comes to the hospital, for instance, to the emergency department, we've already talked about that first point of contact where they're asked some screening questions. If it's appropriate, they're given a mask and moved into a separate area. Visitation for the emergency department, we do ask that it's one visitor per adult patient. We do allow 2 visitors for our pediatric patients because obviously if there is both a mom and a dad, you want to be able to accommodate that. For our inpatients, those patients who are admitted to the hospital for a day or 2, there is 1 visitor per hospitalization per patient. So we do try to encourage patients and families to have a consistent visitor throughout the hospitalization and not change that visitor every day or
so the same person, basically.
That's right. And every time that visitor comes to the hospital, they will be asked screening questions that relate to COVID symptoms and whether or not there has been a known COVID exposure. And they will be given a mask if they do not have one. And we do require masking in all of our public areas for our staff and our visitors. We obviously are not masked right now, and you could consider this a public area, but there's 3 of us in this room. We're more than 6 feet apart, and so we do have some allowances for those types of interactions, but overarchingly...
coming in, I mean, I had to answer the questions, everything, and wore the mask until arriving in this room. And out of respect for everybody watching, we took them off because you couldn't understand us. We'd be mumbling a lot. But that's been fairly recently that all the staff is everywhere you go. I mean, I've been to meetings and whatnot, and people have them on. That the science supports that really is helpful, doesn't it?
So sure, universal masking is one of those elements that we can all do, that we can all participate in. I also, as important as universal masking, is good respiratory hygiene and really good hand washing. So when I talk about good respiratory hygiene, cough into your elbow, don't cough into your hand. When you do have to cough or sneeze, don't do it towards somebody, but turn away. Certainly washing our hands is very, very important. And then the universal masking that's being recommended by so many experts in the field, and certainly is now required by governmental agencies for communities and for states. Doing all of those things will help, but certainly I don't think that we're at a point where we can say it will prevent.
Right.
There's always going to be some level of risk of exposure until we know more about this disease. But those things certainly can help.
And I'm willing to do anything that might help, because I, like everybody else, want to get through this. I want people to get back to work. I want businesses to survive. So
That's right.
we're all in this together, and we all need to do everything we know to do that would help in any way. Speaking of the ED, I hear glowing reports about the speed with which one gets seen, the whole, when you came, and how many years have you been here, Dr. Hayden?
The end of August will be 4 years.
Wow. Well, it's gone by quickly, but you had extensive background in EDs, and folks, many of you still call them ERs, but they are now emergency departments. But talk about how much faster and how much more efficient the experience is coming to the ED now than it was when you got here.
Sure. So we have done a lot of work around the patient flow through the emergency department. And one of the things that, is a little bit mysterious about the emergency department, perhaps, for the patients who come in by private vehicle through the front door, is what's really going on behind that wall. And we've really tried to break that mystery and have very frank and open communication around how patients get seen, where they get seen, when they get seen. When you come to an emergency department, all patients are seen not in the order in which they arrive, but in respect of the seriousness of their complaint or their condition. And so, for instance, somebody could have a complaint of abdominal pain, and it could be anything from a stomach bug to an aneurysm, two very, very different things. And so the healthcare team needs a little bit of time to determine which one of those it is. And so when we look at patient flow, we will do a variety of things to expedite that process and get the patients to the right area of the emergency department with the right amount of resources. And so one of the things we've done is we have put a nurse and a medic in the lobby, and that's the first interaction that many patients have, and it's where the chief complaint or your main symptom is cataloged, and a few additional questions are asked, and we make a determination as to how serious your apparent sickness is. When we look at patient flow, we understand that for the patient, there is a direct link between how quickly I'm seen and how quickly I'm either discharged or admitted to how satisfied they are with that experience. So we break the emergency department visit into segments, such as from the time the patient arrives to the time they're in a bed, from the time they're in the bed to the time they see a physician, from the time they see the physician until the time that a disposition decision is made, whether that's discharged to home or admitted. And by breaking it down into segments, we can make material changes to each segment to shorten that time. So we have put providers in triage so that you see a nurse practitioner or a PA when you're actually in triage. Sometimes patients are able to be discharged from that initial contact because maybe it's a ear pain and it's an ear infection, or it's something simple that can be taken care of quickly. We look at turnaround times for our support services like lab and x-ray and those types of things, and we've put in processes to speed those things along. And we've really focused on the relationship between the healthcare team and the patient, and connecting with the patient on a relational level and understanding where they're at in their healthcare journey and what's brought them to interact with us at that point on that day. And sometimes it is a simple sprained ankle. Sometimes it is much more serious, but making that relational connection and really understanding what the patient needs, because sometimes it's not a medical need. Sometimes it's a social need. Sometimes it's an emotional or a psychological need. So.
Well, and the time at which one gets treated and feels good, as far as what I'm hearing in the community, has really gotten shorter than it used to be. And people are just really pleased with the staff there. I mean, you've got a stellar staff running the ED. We have been very pleased with a lot of providers who are being recruited and coming to the Rocky Mountain area. I know for a while we were kind of plateaued, but surgery, there are 2 new surgeons coming. Is that correct?
There's actually, that is
3?
correct. We've just signed a 3rd one. So Dr. Warnsby started the beginning of July. Dr. Zachary will start the beginning of August, and Dr. Alkire will start the beginning of September. So the Nash surgery practice will have a total of 5 surgeons. Dr. Seaman and Dr. Harrison have been longstanding community members. And they will be joined by the 3 new physicians for that practice. But over the course of the last 18 to 24 months, we really have seen quite a lot of success in our physician recruitment. And that's really good for the community, because it's always best to be able to stay in your community to receive your care, because that's where your support system is, and that's where your resources are. And it just becomes so much more challenging when you have to leave your community to receive care.
And our cancer center, which is affiliated with Lineberg, the Danny Talbot Cancer Center, that people say all the time they used to have to drive someplace for their chemo or radiation or follow-up, but they can be seen here, they can get their treatments here, and it's directly tied to UNC, a comprehensive cancer center, one of the best in the country, actually rated the best in the state for a number of years. But that's been a real boon to our community too, hasn't it?
Yes, that's right. That the opening of the Danny Talbot Cancer Center really was a red letter day for Nash, and Dr. Manicum and Dr. Austin Johnson and Dr. Laura Jackamore, they really are committed to their patients and to that journey that they have to go through when they're in that cancer center, and how we can help them navigate that the best that we can.
Well, and you can just drive up. You don't have to drive out of town, and it's stressful enough to have cancer without having to do that.
Absolutely.
Is it fair to say we're pretty open for business now, having gotten through to this point with the pandemic for elective surgeries and those type of things? So if people have been putting off some of that, the ORs are up and operating and ready for people to come?
Sure, that's a great question. So we started about the 1st or 2nd full week of May, beginning to open up and ramp back up our services and to expand capacity where we had shrunk it down during the height of the COVID initial phase, when we were really trying to figure out the best way to keep everybody safe and learn as much as we could, as fast as we could, about the disease process. In June, we were close to 80% back to normal. July is looking a little bit like 90% back to normal. So certainly patients, we want them to be very comfortable coming here. This is a safe environment. We have all of the PPE that we need for both our staff and our patients. We're very committed to cleaning and disinfecting and using ultraviolet light treatments. And
tell us about that, the ultraviolet light. I mean, that's really amazing.
So we have a machine. Her name is Trudy, and she. We have more than one, but Trudy uses ultraviolet light to further clean and disinfect a room after it's been manually cleaned. And we can also use that ultraviolet light process for some of our N95 masks so that they can be used for more than one day. And so it really is just another step in the cleaning and disinfection process.
Dr. Hayden, it sounds to me like this is one of the safest places in the whole area to come. I mean, other places have unknowns, but you all have addressed the unknowns, you prepared for them, and as somebody who lives here, I can't thank you enough. I mean, it's really, really important to all of us to know that if we have to go to the hospital, you have put in all the procedures and policies to make it absolutely safe for us. And the healthcare that was delayed now, we want to encourage people to go to your doctors now. We're open for business, right?
Yep, we're open for business, we're safe, and we're committed to taking care of our community.
In a wonderful way. Thank you so much.
Absolutely. It's my pleasure.
Thank you for joining us. Have a super day.